Right now, we're just at that conceptual stage about how to move forward in a way that can get everybody to 216. It's important that we don't just win the votes of one caucus or one group, but that we get the votes and the consensus of 216 of our members, and that's kind of where we are right now. So it's premature to say where we are, what we're on, because we're at that conceptual stage right now.
All right, so no indications from the Speaker today as to how soon they will have that health care reworked worked out and ready to go. We're ready to launch and try to get a vote going. House Republican Conference Chairwoman Cathy McMorris Rodgers joining us now. Congresswoman, very good to have you. How close are you think?
Well, we're working through it. We made the decision to delay the vote in order to get it right. And those are the conversations that we're having right now, member to member, colleague to colleague, having those conversations. The real issue comes down to pre-existing conditions. And, you know, for me and many of my colleagues, the President, that is a principle in which we need to make sure is protected as we move forward, that those with pre-existing conditions, other diseases will have the confidence that they will get access to health insurance plans as we move forward. So there's encouraging conversations, and I think we're continuing to move in the right direction. Now,
you've mentioned pre-existing conditions, Congresswoman, and there were some of the Conservative Freedom Caucus, among others, who were not keen on that should not be an outright guarantee, wanted it watered down a little bit. I take it from your remarks last night that you disagree strongly with that.
I do, and I'm encouraged that some of those members that were no are rethinking their position. And those are the conversations that we're having right now.
Rethinking their position on pre-existing conditions, Congresswoman?
Well, and how to write this legislation in a way that will ensure that those with pre-existing conditions are protected, but also can satisfy the key goals of bringing down premiums and returning the policy and the decision-making to the state level. Vice President Mike Pence is really leading a lot of these discussions right now.
You know the process of the House and by extension the Senate far better than I. So why do you bother revisiting the health care thing, given all the wounds getting it out the first go-round? Is it just integral to addressing the tax code thing? Because the consensus seemed to be, well, you know, Republicans are a broader agreement on tax cuts than they are on this thing.
It's very important that we get it right, but we remain united with the goal. This is actually part of our mission to repeal and replace Obamacare. We know that the current path is not acceptable. Even Democrats will say that there needs to be some changes.
Why put it before tax cuts?
Well, the vehicle that we have put forward means that we got to do it before we start moving on the budget. The reconciliation process that I think is the most effective way to get a bill through the Senate and onto the President's desk. And my goal is results. It's not about having a show vote. This is about getting results, a process in which we will be able to get a bill on the President's desk.
So this means that you've got to settle this health care thing one way or the other before you can move on to taxes, right?
You know, I'm not going to put a timeline on it. We're working through it. It remains a priority. Tax reform is also a priority. As you think about what it's going to take to get our economy growing, get people back to work, get innovation going in this country, tax reform is at the top of the list, and Republicans are very excited to get going. Both of these are going to remain at the top of the list as we continue through the next few weeks and months.
All right, a few weeks and months to deal with the health care thing?
You know, we're just going to keep it going until we get to the place where we have the votes we need.
Are you of the mindset, Congresswoman, that you want to deliver on the corporate tax cuts and corporate tax reform, and maybe individual rates could come next year?
I am of the mindset I would like to move both individual and corporate tax reform at the same time. We have the highest corporate tax rates in the world, and we need to bring those down. Individuals suffer under a very complicated, costly tax code. And as you think about giving certainty, allowing individuals to keep more of their hard-earned taxpayer dollars, I believe it's important that we do those together so that we're providing certainty to everyone in this country.
Is it certain as well, Congresswoman, that the likelihood of getting any Democrats to join you in this effort is well unlikely, and that maybe given the back and forth over Judge Gorsuch is a reminder of how poisoned the well is for cooperation between the parties, so that if you pursue this health care thing as you are and the tax cut thing as you want to, that it will come without Democratic support?
I believe that if we can get through this first hurdle on health care reform, that we will be able to move other aspects of health care reform in a bipartisan way. I co-chair the Rural Health Caucus, and I'm working right now with my co-chair, Ron Kind, Democrat, we're working together on provisions that are important to rural health, on reimbursements for rural health hospitals, for example, and other providers. And we will continue to work on those type of provisions, and we'll do it in a bipartisan way. So I believe that there is an opportunity to work in a bipartisan way as we move forward.
Chairwoman, finally, I wanted to get your sense of the way Donald Trump was very angry at the Freedom Caucus for blocking this reform effort. At least he said it wasn't perfect, but it was far better than Obamacare, and that he was even considering primary challenges against some of them. Justin Amash, for example, of Michigan, to send that message. What did you think of that? How do you feel about that?
I see that Donald Trump is someone who wants to keep his word. He wants to keep his promises. And one of the promises that Donald Trump made was to repeal and replace Obamacare. And the bill that is under consideration right now is an important first step. It's not the end-all, be-all, but it takes an important first step. It is the underlying bill. The base of the bill is the bill that we put on President Barack Obama's desk last year.
But do you think he's
vetoed.
justified in going after those members who don't share that view or challenge that view, even to try to get a party challenge, a primary challenge to them if they don't go along?
President Trump continues to keep the lines of communication open, and that, I think, is going to be most important, that he and the House members, the Senate members, we are united around this goal, and we need to keep the lines of communication open so that we can actually get the results, so that we can get the bill on the president's desk. And those members, as I have conversations with them, they are encouraged too. They want to be a part of a solution. They want to, many of them have told me they want to get to yes, and that's where we need to be.
All right. Cathy McMorris Rodgers, the House GOP Conference Chairwoman, thank you. Good seeing you again.
Thank you.